lips, mouth, nipples, anus, prostate, and even during childbirth. All of these are moments when orgasms can happen. I'm Dr. Rena, and today I'll be talking about reports of people reaching orgasm without any direct genital contact. If you're new here and enjoy this content, be sure to subscribe and share this channel with your friends. During an orgasm, people often describe it as a shift in consciousness, and it can lead to a deep sleep or a calm, peaceful state. In fact, the French even have a phrase for this called la petite mort, which essentially refers to the deep rest that follows sex and orgasm. Interestingly, when you look at how the brain changes during orgasm, they closely resemble the patterns seen in people experiencing seizures. That's pretty remarkable. So, let's go over the different parts of the body that have been reported to trigger orgasms in some individuals. The first category is what we generally call erogenous zones. And what does that mean? Well, these are areas of the body that are especially sensitive to touch. These are not always the typical regions associated with orgasm, but with repeated stimulation, they can sometimes lead to one. In a study involving 216 individuals, nearly 40 people reported having orgasms from stimulation in unusual or unexpected areas of their body. For example, some described it happening from their neck being kissed, their thigh or groin gently touched, or even from having their fingers sucked. This brings us to the next area, which is the mouth. It's no surprise the mouth is highly sensitive. You can see this even in infants who naturally suck their thumbs, pacifiers, or bottles. It's believed that parts like the lips, tongue, the roof of the mouth, and even the throat can be stimulated in ways that for some people may lead to climax. And that may help explain why some individuals feel aroused when giving oral pleasure to a partner. Next, let's talk about the nipples, and I've covered this briefly before. Nipple stimulation can lead to orgasm for many women, and even some men. And why does this happen? There are two main reasons. First, stimulation of the nipples releases a hormone called oxytocin. This is the same hormone that increases after orgasm, and it can stay elevated for several minutes afterward. Second, the areas of the brain activated during nipple stimulation are very similar to those activated during genital stimulation, such as vaginal or clitoral touch. As you can see in imaging studies, the same brain regions respond during both types of stimulation. The anus, separate from the prostate, which I've discussed in another video about prostate massage, can also be a source of pleasure for some individuals. This is because the anus sends nerve signals through the pelvic nerve to the spinal cord, and that same nerve pathway is involved in signals from the vagina, cervix, and rectum. So, just as some women can reach orgasm through vaginal penetration, some individuals may experience it through rectal stimulation as well. Additionally, stimulating the rectum or prostate in men, while also providing penile or clitoral stimulation, can increase the intensity and complexity of orgasm for those who find it pleasurable. Finally, you may have heard discussions in mainstream media about orgasms during childbirth, and while it's rare, it is real. Less than 1%, or about 0.3% of women, have reported experiencing this. There are a few possible explanations. During the baby's passage, areas that are typically sensitive, such as the G-spot and vaginal canal, may be stimulated. Another factor is the release of oxytocin during childbirth, which, as mentioned earlier, is also linked to orgasm. And lastly, the areas of the brain activated during pain are quite similar to those activated during orgasm, which may explain why some individuals are drawn to experiences that combine sensation and intensity. Next, it's also possible to have erections during sleep without any direct stimulation. I've made a full video on morning wood or nocturnal penile tumescence explaining why this happens. Erections at night in both men and women are largely due to hormonal shifts, sleep cycles, and nervous system activity, rather than physical touch. And lastly, in individuals with spinal cord injuries, this is especially interesting to me since I work with many such patients. While they may have difficulty reaching orgasm, the skin just above the level of injury often becomes very sensitive, and when stimulated in a specific way, it can sometimes lead to orgasm, even in those with spinal cord challenges. There is also a condition known as persistent genital arousal disorder. If you'd like to learn more about it, feel free to comment below. It's a complex and often distressing condition for many people. As always, remember to take care of yourself because you deserve it.